bienvenue dans Topik Konversasyon. Et pareil, moi, Cindy Pibonnet dans Topik Konversasyon. Aujourd'hui, nous pour aller un petit coup, quand nous lisiez, nous la santé nous lisiez, s'il y a bonne santé. Et aujourd'hui, bon matin, nous pour cause bien sûr le cataracte, nous pour cause diabète et tension dans les yeux. Et aujourd'hui, ça qui pour aider moi à faire ça, et bien si un eye specialist a sorti côté clinique Dr Murthy qui nous aide là bon matin. Nous interview pour un qui en anglais, mais pas hésiter pour demander nos questions, soit en créole, soit en anglais même. Et docteur qui nous aide là, il est capable de répondre tout aux questions pertinentes, ça c'est qui nous peut cause là. Aujourd'hui, bon matin, monsieur, madame, mademoiselle, je me présente avec docteur Manasa. Et puis, ici, c'est celle, bien sûr, environ 8 ans, là, depuis là, ici, il travaille avec le ministère de la Santé avant. Et là, présent, il est dans la clinique côté docteur Murthy. Qui visite sa clinique là-bas, m'assurer, on est capable de joindre là-bas. Docteur Manasa, bonjour.
Bonjour Cécile.
Comment ça va?
I'm fine, thank you. And you?
Bien, merci pour aujourd'hui bon matin. So how long have you been here in Seychelles now?
I've been here from almost 9 years, 2015, but I'm working at Dr. Murthy's from 2017.
From 2017?
17, yeah.
Voilà, depuis 2017, il a pu travailler avec la clinique Dr. Murthy et Dr. Manasa, il est sorti de l'Inde, bien sûr. Il m'a dit, si on fait visite avec Dr. Murthy, à un dernier moment, là, on est capable de battre lui, en ce qui concerne les yeux. So, the first one, we will take eye cataract.
Okay.
What causes cataract, doctor?
Okay. I'm happy that we are talking about cataract and awareness of cataract, one of the most commonest conditions that everybody develops with age. What causes cataract? Age. It's one of the commonest reasons. It's a condition where everybody above 50, 55, 60 years eventually develop cataract. And also there are many other reasons like metabolic, chemical, and also newborn children because of various infections during birth also develop cataract. So the most commonest condition is with age. When people age above 55, 60 years, they eventually develop cataract. So what is cataract basically? See, it's like everybody, we have lens inside our eyes. When we are born with a lens. This lens is a transparent structure and it acts as a camera. The eye acts as a camera. So this lens captures the image and sends to the brain. Both the eyes capture the image and send to the brain to form one image in the brain. So that is what we look at. So my right eye captures a vision, my left eye captures an image.
Another vision, the same vision or another vision?
The same vision.
The same vision.
Yes. So right eye captures an image, the left eye captures an image, it goes to the brain and forms one image. And to capture these images, we need a clear lens through which the light can pass through in a transparent structure, okay? So we all have the lens inside our eyes which is transparent. What happens with age is there are a lot of metabolic changes that happen in the lens because of which the lens loses its transparency. So it's no longer transparent, the light cannot pass through clearly. It from a transparent structure, it becomes an opaque structure or a translucent structure. So cataract is a condition where the loss of vision happens in a patient gradually. It never happens suddenly. Okay, unless and until there is an accident or there is a severe trauma to the brain or something like that, it's a very gradual process through which the patient complain as from the past 6 months or from the past 2 years or 1 year, the vision has started to deteriorate. And that is when we have to evaluate for patient for cataract.
Is this one that you have a blur vision?
Yes, this is what is called as a blur vision. Blurred vision happens for multiple reasons, you know, glaucoma, diabetic retinopathy, cataract. But amongst all these conditions that I have mentioned, cataract is one of the commonest conditions which happens to everybody irrespective of any other abnormalities they might have. They might not have glaucoma, they might not have diabetes, but still they will eventually develop cataract. You and me also someday will develop cataract.
Can develop cataract.
Yes.
C'est madame mademoiselle de la cour, nous tous, nous capables, à un moment donné, nous sommes capables de développer cataract. Pareil dit, il y en a pour faire avec nous l'âge, over 50 years.
50 to 60 years.
Par là, 50 ans, 60 ans, en montant, il est très probable que nous capables de développer cataract. Here in Seychelles, how common is cataract?
See, in cataract, like any other part of the world, there are a lot of patients which come under the category of needing intervention for cataract surgeries. And in my experience, about 45-50 years average, a patient develops cataract in Seychelles. That is what I've noticed in my experience in Seychelles.
When do you think is the time for surgery?
Okay, see, basically we have to evaluate a patient who comes for an eye examination complaining of gradual defective loss of vision. So what we do is we check the pressure of the patient, we check the vision of the patient. This is all documented and these are all protocols, and then we ask the medication history, allergic history, we ask the other symptoms for which they are on treatment. Okay, and then we do a anterior segment evaluation and then a posterior segment evaluation. That means we dilate a patient's eyes to check the cataract. When we check the cataract, what we actually do is we grade a cataract. Okay, it comes under grade 1, 2, 3, 4. When it's in grade 1 and 2, it's still very small and tiny.
It's too small for
It's
surgery?
too small, yes. That means it allows light to pass through and fall on the sensitive layer retina. So the patient still has vision. With the glasses, their visions can be improved. Okay? But when it comes to grade 3 and grade 4, that is when the cataract is thick, hard, and it starts to become more opaque, and the light that it allows to pass through and fall on the retina is very, very less. So irrespective of the kind of glasses they want to buy, the amount of money they spend on glasses, the vision doesn't really improve. So that is the stage when it is in grade 3, grade 4, that is when we have to do a cataract surgery, remove the lens from the eyes, from inside the eyes, and we have to put an intraocular lens in its place, again which is a transparent lens, so that it allows the light to pass through and fall on the retina, which is the sensitive layer of the eye.
And the surgery, how long does it take?
See, these days we have the best equipments, the best modalities. The latest one, which we call it as a phacoemulsification technique, where we don't make an incision, we don't enter the eye through an incision. Okay, we make small openings, we enter the eyes, use a laser technology, and we don't even give an injection. You know, before few years back, 20, 30 years back, we had to give injection, enter the eyes, cut open a section of the eye, get inside and remove the cataract as a whole. But now we no longer do this modality. We have this state-of-the-art facility where we just operate a patient's eye on topical anesthesia. That means we just put a drop of anesthesia, okay, that's all, just drop of anesthesia, and we make a port of entry, and instead of taking out the cataract as a whole, we break them into pieces and we suck them out through the phacoemulsification technique. That is how it's done. So instead of taking out the whole of cataract, for which we need to open it on a wider way, we breaks into pieces, and then we take small tiny sections through the phaco techniques. So that is the latest one that is performed all over the world, and that is what we have in our center.
Is it painful?
It is not painful. You'll not even make out that, you know, you've had a cataract surgery. It just takes around 7 to 10 minutes.
Really?
Yes, it just takes around 10 minutes, maximum 17 to...
Depending
depending on the thickness of the cataract. If it's too hard, if it's too thick, probably it might take 2 to 3 minutes extra, but maximum 10 to 15 minutes.
10 to 15 minutes.
Yes.
Bonne nouvelle, il y a une latest, une dernière version en qualité surgery qui sont capables de faire dans l'espace 10 à 15 minutes, dépend qui grosseur ou cataracte qui était, qui pour faire surgery. Mais c'est une bonne nouvelle, c'est qu'ils n'ont pas senti douleur, ou pas même imaginer pour dire, on fait un petit l'opération cataracte, alors pourquoi pas, on prend sa décision et ça bon service, il peut gagner faire que le docteur Murthy, le docteur Manasa, il a ça même ça qu'il peut expliquer. What about treatment?
Yes, so once the cataract surgery is done, once the cataract is removed, we do certain investigations before we do the cataract surgery, like we do the blood investigations to find out if the patient is diabetic, hypertensive, any other cardiological conditions. We treat it first. We make sure that the patient is completely fit for surgery. We also do a ECG to make sure that there is no abnormalities, no arrhythmias, and then what the physician treats in our center before we take up the patient for surgery. And then the surgery is performed, 10 to 15 minutes like I mentioned, and then the patient is given certain drops so that there's no infection after surgery, there's no inflammation after surgery, and the patient recovers the vision immediately. Within the next 1 to 2 hours, the patient will be able to see perfectly. So we follow up the patient every week, once a week, up to 1 month, so that we keep in touch with the patient and, you know, we take a note of the improvement in vision.
At this stage, doctor, you've done the surgery, everything's okay, you've done the treatment, come back and forth to the doctor for checkup. Can cataract return back after that?
Very, very good question. This is one of the commonest questions that people come up to. You know, can it come back? No, it never comes back. So cataract is a lens which we are all born with. Once it is removed, it cannot grow back. We have removed it completely from the eye and we've put a new lens in its place. We've not left the place empty. We've put a new lens in that place. Now this acts as a lens which takes a picture and sends the image to the brain. Okay? So when it is transparent, the light goes through the lens and falls on the retina. So once the cataract is removed, it doesn't grow back.
And we have our first question from our viewers, doctor. He says, good morning, Carol and Dr. Manasa. Good morning to you. Do you do removal of silicone eye in the eye and how much it costs? Please, thank you.
Okay, silicone oil is not related to cataract. Okay, that's the first thing. And the second thing is, if a silicone oil is put, that means the patient would have had surgery concerning to diabetic retinopathy. Okay. We do not do this in our center. We do not do surgeries related to diabetic retinopathy. We do not put silicone oil and we do not remove silicone oil from the eyes.
Voilà la réponse pour la question. What is the success rate after cataract surgery?
It is 100%.
100%?
Yes. See, again, if the patient has only cataract, there is no other abnormalities in the eye like diabetic retinopathy, glaucoma, their vision will be 6/6. That means they have the perfect vision. But if they are having other underlying issues like diabetic retinopathy, end stage glaucoma, in that cases, the surgery will be successful. It will be 100%. But the vision improvement is not as good as any other normal patient because of the other underlying abnormalities the patient suffers from. But the cataract surgery is 100%. That means we remove the cataract from the eye, we put the lens inside, we wash all the cortical matter and it's a 100% success surgery.
Side effects?
There are not really any side effects, but yes. See, when we remove the cataract, there's a membrane below which is called as a posterior capsular membrane. Okay, it's like a bag. You remove the cataract from the bag and you put the lens inside. So there's a bag holding the lens. So when you put the lens inside, the bag is holding it. The posterior capsule is holding it. With age, with time, probably 6 months, 1 year, 2 years, this posterior capsule might become dusty. There might be water deposition, there might be air deposition on the posterior capsule, which results in defective vision for the patient, but it doesn't happen in 100% of the patients who undergo cataract surgery. It does happen to 20 to 30% of patients. Again, this is not a complication because of cataract surgery. It happens to few people depending upon their age, the kind of life they lead, the kind of food they eat and all. But again, we do laser. It just takes 10 to 20 seconds. We do a laser and open up behind the lens so that the dust, whatever the dust is there behind the lens on the capsule, we clean it up.
Gets clean.
We can clean it. It gets clean and the vision comes back.
As simple as that.
As simple as that.
Voilà, un petit peu bon détail qui nous peut demander. Et puis, question, là, par exemple, il y a un nouveau l'équipement. Quand le docteur Murthy, bien sûr, il n'est plus fait sa façon qu'il fait 20 ans, 30 ans passés, le temps qu'il fait l'opération pour cataracte. Là, quelque chose de plus vite, within 10 à 12 minutes, on finit capable de faire une surgery pour cataracte. Alors, on a une petite visite. Quand le docteur Murthy, more questions coming in. This one is in Creole. I will translate it for you. Do you do surgery for myopia or any form of treatment?
See, when we talk about surgery for myopia, it's a short-sightedness. That means the patient's near vision is very good. They cannot see the distance vision properly. In this condition, we have to do a corneal surgery. That means a LASIK or a SMILE, to improve the patient vision so that we avoid them wearing from glasses. This is again nowhere related to diabetes or it's nowhere related to cataract. This surgery is not done in our center or it's not done anywhere in Seychelles.
Okay. Voilà la réponse pour question. Doctor, how long does it take a patient to recover after cataract surgery?
Okay, usually 3 to 5 days.
3
they
to 5
have
days.
3 to 5 days. They have to take care of themselves. That is the time we call it as a danger phase, where they might develop any kind of infection if not taken care of themselves properly, or if they do not administer the eye drops properly. That is the time we call it as at least 3 to 5 days. They have to be very careful. They shouldn't go out much. Do not expose to dusty environment. Do not get into swimming pool or beach.
Exercise?
Exercise they have to avoid for at least 3 weeks.
3 weeks.
3 weeks to avoid exercise, but after that they can lead a very normal life.
And driving just after cataract surgery?
At least a week's time, a week's to
time.
10 days, and then they can start driving.
Voilà la réponse pour bonne question qui nous peut demander là aujourd'hui bon matin. Somebody in Creole, I said, he or she says says last time she checked her eyes, the doctor said it was normal, but she's still seeing blurry vision. She still has blurred vision.
Okay. See, when we talk about blurry vision, it is not 100% of the times because of cataract. Okay, there might be a lot of other reasons why the patient might not see properly. There might be corneal issues. There might be infections, there might be inflammations, she might be having glaucoma or some diabetic or hypertensive retinopathy changes. So, it's very important for the patient to visit an ophthalmologist, get the preliminary evaluations done, get a fundus examination done by dilating the fundus, have a complete eye checkup, and then when the diagnosis is made, she will know if it's because of cataract or any other reasons.
Voilà la réponse pour question get a complete test done. More questions coming in. This one still in Creole. Her mom has done cataract surgery, but still she still sees blurry from one side.
Okay.
Yes, and she has done laser, but she still sees blurry.
Okay. See, first of all, the age of the patient matters. When a patient is really 80, 85 years, they also develop neurological changes in the eyes. The optic nerve, that is one of the cranial nerves, the optic nerve, if there is degenerative changes, which we call it as anterior ischemic optic neuropathy, there is any kind of brain damage that happens, any kind of brain abnormalities are there, the eye suffers, okay? Irrespective of the surgery being done 100% well, the patient will not be able to see properly if they have optic nerve changes, or again glaucoma, diabetes, all of these play a very important role for the patient to have the best vision 6/6.
La réponse pour question. Good morning, doc. How much does it cost to remove cataract in one eye?
Am I supposed
Prices, yes.
Okay.
Yes.
So we actually charge 23,000 rupees.
23,000 rupees.
Seychelles rupees.
Seychelles rupees. Ça veut dire équivalent en créole 23 000 rupees for one eye.
One eye.
Pour petit cataracte dans un côté des yeux, il coûte 23 000 rupees l'argent Cécile pour retirer à la
But we do have discount when they
do have discount. Can we negotiate the price?
Yeah, we can negotiate the price provided you do both your eyes.
Mais seulement ça pour être capable de gagner négocier. Par contre, si vous pouvez faire tous les deux, il y a une réduction. Alors, pas besoin d'hésiter. Pour descendre, gagner un petit causé, faire ça dialogue avec le docteur. Bien sûr, hi ladies, hi to yourself. Or after cataract surgery, can you walk to exercise, please? Doctor, can we walk to exercise after cataract surgery?
Yes, you can do walking. At least 5 days, be careful, take care of yourself, stay indoors, do not expose yourself to bright light. Though you can watch television with dark glasses, do not expose yourself to bright light or any place which is too dusty. But after 5 to 6 days, you can walk around, if not going on a treadmill, but you can go around in your garden. In the park, in your garden. It's very important, to walk. So, yeah, you can.
Good morning, Carol and Dr. Manasa. Carol asked doctor, why even you have done retina surgery and you still see blurry vision? Can doctor advise, please?
Yes. Unlike cataract, the prognosis is 100%. That means no other underlying issues, the patient can see perfect. Okay, but when a patient has diabetic retinopathy, the prognosis is extremely poor. That means the retina itself is so damaged in a patient with diabetic retinopathy, by the time it reaches the surgical state, the amount of bleeding that happens, the amount of lasers that has been done, the damage to the retina is almost 80 to 90%. So, in spite of having a retina surgery, the vision improvement is very poor. So, before we do retina surgery, we tell patients that prognosis is poor. That means the visual improvement after the surgery is poor.
Voilà, bonne la réponse pour votre questions. Merci beaucoup pour votre contribution là bon matin. Pas hésiter pour demander nos autres questions. Docteur est là pour répondre aux questions. Aujourd'hui, nous cause la première partie, le cataracte in the first place. Là, présent, nous pour bouger l'eau et l'autre qui peut commun, nous avons dit menace pour les yeux. Bien sûr, c'est quelque diabète avec tension dans les yeux. Retinopathy, diabetes and hypertension.
Yes. See, these conditions, diabetes, hypertension, these are systemic conditions. That means it's not restricted to the eye. It's a systemic problem. It's there in the system, in the body. So, diabetes, hypertension, these are there in the body. So, what happens when a patient has diabetes? It just doesn't affect the eye. It affects the brain, which is called as diabetic neuropathy. When it affects the eye, it is called as diabetic retinopathy. When it affects the heart, it is called as diabetic cardiopathy. When it affects the kidneys, it is called as diabetic nephropathy. So, here I am there today to talk about diabetic retinopathy. So, when the diabetic affects the eye, well, that means when the blood sugar levels are elevated in the body, okay, when they are not in the normal range. Every entity has a normal range, like blood pressure has a normal range, the blood sugar levels have a normal range. So, when the levels of blood sugar levels in the blood is elevated for a longer time, that is when it starts to show in the eye. Okay. Now, we have classifications. The ETDRS has classified how we have to grade when a patient has diabetic retinopathy. So, first of all, the duration of diabetes is one of the very important entities. A patient with 1 year of diabetic retinopathy might have end stage presentations. Okay. So, a patient with 20 years of diabetes might not have any findings in the eye. Okay.
Really?
Yes, might not have any findings in the eye. I have a lot of patients who are 20-25 years into diabetes. They do not have diabetic eye disease. Okay. This is again depends on patient to patient. There is no strict rule that you've developed diabetes or you've developed hypertension. That means you'll definitely have a diabetic retinopathy or hypertensive retinopathy. No, not necessarily. Okay. There is a lot of factors which go into play. Okay. How well you've controlled the diabetes, your genetic factors, your hereditary, all of these factors are very important to to check if the patient has diabetic retinopathy or not. The first category is no diabetic retinopathy. So, irrespective of the number of years the patient is having, if it is well controlled, the patient does not present with diabetic retinopathy or diabetic eye disease. The next is non-proliferative and proliferative stages. Non-proliferative stages is a stage where there is no active bleeding in the eyes. There are certain changes like mild, moderate, severe, very severe non-proliferative diabetic retinopathy, where there are changes where there are mild and small tiny bleedings, microaneurysms, hard exudate, all of these are there, but there is not much of bleeding in the eyes. Okay. Then comes the last stage, proliferative diabetic retinopathy. This is the stage when there is active bleeding in the eyes. And why is the bleeding that happens in the eyes because of diabetic retinopathy? It is because there is a there is a circumstance of hypoxia created within the eye. Hypoxia is reduction of oxygen levels. The brain feels that there is less oxygen supply in the eye, because of which new vessels are formed. There is growth of new vessels inside the eyes, and these new vessels that grow in the eye, they are called as abortive vessels. That means their structure is not strong. So, these vessels grow, they supply blood to the eye and they abort, they break down, and when they break, they bleed. They bleed. So, what we generally do is, whenever we identify that there is a new vessel growing on the optic nerve or around the optic nerve, that is the stage we call it as a proliferative diabetic retinopathy. We do laser so that we create a condition inside the eyes where it becomes from hypoxic to anoxic. That means it's like the eye is wanting for oxygen, because of which new vessels are growing. We create a situation where the eyeball is no longer wanting for oxygen, so that the new vessel doesn't grow. The new vessels don't grow, and whatever new vessels have grown, we ablate them with lasers. We give laser shots so that we seal it so that it doesn't bleed. And even if there's bleeding in the eyes, even there's blood in the eyes, we do laser so that with time the blood gets absorbed. Okay, so this is all talking about the background diabetic retinopathies. Now talking about the central part, diabetic maculopathy. Okay, so whenever a patient comes to us, sometimes even till the proliferative diabetic stage, they do not complain of anything. Their vision is good, but when we actually check inside the eyes after dilatation, there's bleeding, but it's in the periphery, and in the center of the eye, it's dry. So the vision is good. But when a patient develops diabetic maculopathy, that means there's fluid collection. There is leakage of fluid in the eye resulting in loss of vision. Okay, so there is swelling in the diabetic because of diabetic retinopathy. There is swelling in the retina. There are 10 layers in the retina. So in between the layers, there is collection of fluid. There is
when
leakage.
It's swelling, it's not good.
It is not good. The patient cannot see properly. Okay, so that stage, we don't do lasers, we give injection.
Injection?
Yes.
Instead of lasers?
No, laser is for background, okay, so that it stops the bleeding. But in the center, for the loss of vision, when leakage is the reason, what we do is we give injection to reduce the swelling at the center. Okay, because we do laser at the center, the patient loses vision. We cannot give burns. We cannot burn the center part of the eye. So it's only at the periphery that we are allowed to do the laser. For the central improvement in vision, if the patient needs, we give injections, intravitreal injections.
Voilà, bonne l'explication, détail, bien sûr, qui nous peut causer un petit peu le diabète, hypertension dans les yeux. Bien sûr, doctor, what is the relationship between hypertension and diabetic retinopathy?
Hypertension is a separate entity. Diabetes is a separate entity. It not necessarily requires that all the patients who have developed diabetes will develop hypertension. Not all the hypertensive patients will develop diabetes. Again, it is a systemic condition. When the blood pressure, see, there are various pressures in the body. There is intracranial pressure, there is intrathoracic pressure, there is intraocular pressure, and there is blood pressure. So this is a systemic condition. Whenever the blood pressure is elevated, when it is beyond the normal range, okay, it affects the eye. Like all the vital organs, it affects the brain, it affects the heart, if it affects the kidneys, also it affects the eye. So whenever there is hypertensive retinopathy resulting in the eyes, again we have to do certain investigations. We check the pressure in the patient, we do fundus examination, we dilate a patient's eye, and then when we check inside, when there is hypertensive changes that happens, normally we tell 3 things for patients, whether they are diabetic or hypertensive. Okay, first is strict diet control.
Diet control.
Diet control. They should know what to eat, what not to eat. They can meet their nutritionist or their district doctor or their general physician to find out what they have to eat and what they shouldn't be eating. The second most important thing is medications, whether they are on metformin tablets or they are on injections, insulin injections, or they are on any other type of tablets for hypertension. They have to take the right dosage at the right time. The third most important thing is every day 20 minutes of brisk walk. Exercise is most important.
Brisk walking?
Brisk walk every day, 20 minutes. At least 20 minutes is going to help. So these 3 things are very, very important in a patient to reduce the occurrence of diabetic retinopathy or diabetic hypertensive retinopathy in the eyes, and maintain the blood sugar levels and the blood pressure, so that it doesn't go beyond the normal range. Yes, yes. So when the hypertensive retinopathy happens, again, at the AV crossing junctions, there is bleeding. There's bleeding that happens inside the eyes. There is retinal detachment that happens because of hypertensive retinopathy, for which, yes, we do lasers. Also, we give injections whenever there is macular edema. So, but for all of this, primarily evaluation of the eye is most important.
The most important, et plus important, s'il vous plaît, nous arrivons dans un stage comme ça, nous l'a dit, premier quelque chose, the lifestyle, your lifestyle, où nous l'a dit, veiller, what not to eat and what to eat, les détails comme ça, get un peu détails avec, bien sûr, un nutritionniste, mais le docteur même est capable de dire quoi que vous besoin manger et quoi que vous besoin pas manger. C'est très important ça, hein? Parce qu'on est aussi si la léger, dans la banque quelque chose, nous pouvons apprendre taper quelque chose là bon matin. If I will go back to the 23,000 rupees, there's questions about it. What is it? What do we get in the 23,000 rupees?
Okay.
And can we pay by installment?
Yes, it's a good question. Yeah, I have to address it by installments. Suppose we will be conducting the cataract surgery very soon in our center. You can pay 5,000, 5,000, 5,000 whenever you are comfortable. And after you finish the payment, okay, after you finish the payment, the next slot we will book you. Okay, we will be doing the surgery. And what you get out of this 23,000 rupees, we do the blood investigations, we do the ocular examination. That means we have to find out what powered lens you need. So we have to do certain scans to find out the power of lens that we are going to put inside. We will be importing the lens, the best quality lens, and then this package includes the lens that we put inside the eyes, the surgeon's cost, and also the operation theater cost, and then the surgery. Okay, all of this is inclusive in this 23,000 rupees.
Inclusive.
Yes.
Voilà un petit peu ça package 23 000 quoi qui compris là-dedans. Can someone pay the surgery? OK, mon quoi on est sur une fait besoin nous là nous fait cause là oui, nous capable faire ils autres capable faire par installment bien si qui ça 23 000 qui nous fait payer cause là qui fait besoin nous. Oui, capable faire par installment et là on finit payer ça installment là on est then qui est capable faire sa surgery et Marie-Céline oui, ou capable faire par installment. If one eye is affected, doctor, what will happen to the other? Is it automatically infected or
Okay,
it's
see,
just one eye?
see, cataract is usually bilateral. That means both the eyes are affected because it happens with age. It is not any other condition where only one eye is affected, the other eye is not affected. But it's not 100% equal. That means one eye might have grade 1, the other might have grade 2. This eye might have grade 2, this eye might have grade 3. There is a slight difference or it might almost be the same. Okay, but eventually you will have to get the surgery done in both eyes. Okay, because with time both eyes will develop cataract.
With time it will get affected.
Yes, both eyes will get affected with age.
With age.
With age.
Par le docteur peut dire avec l'âge, même si un côté il gagne affecté, bien si l'autre côté aussi, lui il peut gagner affecté, mais seulement avec le temps, on peut besoin faire ça. Du mais seulement on va bénéficier peut-être de ça 23 000, si vous pouvez faire tous les deux côtés, on va gagner une réduction, on est capable de négocier aussi. Quand le docteur il comprend que il dit pas capable répondre en créole, il est capable de négocier les temps où aller, les temps où gagner un petit dialogue avec les autres, ou gagner quelque chose de ça 23 000, un package ça bien si, mais souvent gagner un petit causé. Diagnosis, docteur?
Pardon me?
Diagnosis.
The diagnosis is done after the evaluation of
After the evaluation.
Yes, after the evaluation of the patient, the anterior segment, the posterior segment, and the pressure. The pressure is also a very important entity. If the pressure in the eye, the intraocular pressure in the eye, if it's elevated, we do not take up the patient for surgery immediately. We have to reduce it. All the parameters should be in the normal range. The diabetic levels, the hypertension levels, the blood pressure levels, and the eye pressure levels, the intraocular pressure. All of this has to be in the normal range to take up the patient for surgery. So all these evaluations are done and we calculate the power of the lens that we have to put inside the patient's eye, and then once the physician gives a fitness, that is the heart, the blood sugar levels, when everything is normal, then the case is posted for surgery.
What is the most common or the most important factor for diabetes retinopathy?
Diabetic retinopathies, see, first and primarily it is hereditary. Okay? Hereditary. Suppose your parents have, you 60 to 70% you might develop, but again it's not 100%. It also depends on the kind of life you live. You know, if you're alcoholic, if the patient is a smoker, they have a very sedentary lifestyle, they are druggies, they take drugs, any other kind of substances which are not healthy, you know, to the body, or they're exposed to certain chemicals, or they work in an emergency kind of a stage where they are prone to accidents. You know, all these conditions are the risk factors for cataract.
Diabetes. Facteur important qui docteur a nommé, bien sûr, nous peut cause le diabetes rétinopathie, un facteur plus commun dépendant de l'âge, bien sûr, héréditaire. Pareil, le docteur dit, mais souvent dépendant de lifestyle aussi, la façon qu'il peut vivre pour capable dire chef fait ci ou fait ci, ça bon facteur là, the substance, symptôme. Symptoms.
The symptoms. The symptoms of diabetic retinopathy primarily is loss of vision. Okay. Now, this, like I mentioned already, unless and until the central part of the eye, that is the diabetic maculopathy, unless and until the center part of the eye is affected, the patient usually doesn't come to a doctor. So, through this interview, I want to tell all the patients, if you are diagnosed as a diabetic mellitus patient, that means your blood sugar levels are elevated than the normal range, please visit your ophthalmologist. Okay. We have to do a complete eye examination and find out whether you have diabetic retinopathy or not. If you do not have diabetic retinopathy, we follow up every year. Every year we follow up. Suppose you have diabetic retinopathy and it is not at the center, there is treatment for that. We need to treat it if the center of the eye is not affected, though you have perfect vision. If it's treatment for the bleeding which happens at the periphery, we will have to treat it. Suppose the patient comes, blurry vision, there might be blood. The macula might be fine, there is no swelling in the eyes, the diabetic maculopathy is not there, but still because of bleeding, excessive bleeding in the eyes, that we call it as vitreous hemorrhage, the patient needs intervention. Okay. Initially we can do lasers and reduce the bleeding, but when it is in the end stage, when the blood is too much so that we cannot even pass through the vitreous cavity to go and hit on the retina, that is when they need to get the blood removed. This is the surgery, vitrectomy, where the vitreous inside the eyes, there is something called as a vitreous. It is a jelly. Okay, inside this jelly is filled with blood. This blood has to be removed along with the vitreous, and we put silicone oil. Okay. So, it is better not to allow the eye to go through that stage. So, the prevention is better than cure. So, once you are diagnosed with diabetic mellitus, that means you are diabetic, come to an eye specialist. We will dilate your eyes, we will look inside the retina, and we will grade your diabetic retinopathy, whether no diabetic retinopathy, mild, moderate, non-proliferative or proliferative, and treat you accordingly so that it does not go to that levels where you need a surgical intervention. We can avoid it by doing lasers or giving by injections.
Cecile, prevention is better than cure. We can avoid it. Doctor, let's talk about prevention.
Yes, like I mentioned, three things. You should know what to eat, what not to eat. You have to take the right amount of medicine, the right amount given by your doctor at the right time, and 20 minutes of brisk walking. And please follow the doctor's advice. If they've asked you to come and visit them every 3 months, I ask my patients to come and visit me every 3 months if I have done laser. If I have not done laser, then every 6 months. If there is no diabetic retinopathy, we ask them to follow up once a year. So, follow your doctor's advice very strictly, do not miss your appointments, and take care of yourself. You know, do not consume too much of alcohol, do not smoke too much, do not have a sedentary lifestyle. Be active, involve yourself in something, and not only physically, psychologically also it's very important for a patient to keep themselves happy. You know, I've seen many patients who are 20, 25, 30 years into diabetes,
yes,
and they're so perfectly fine, their eyes are fine, and they tell me, doctor, I laugh every day, I sing every day, I'm a very happy person. So, there is a 1 to 2% of psychological factor which also is involved, you know. When you keep yourself happy, you know, you avoid a lot of diseases.
You're one healthy person. C'est ça, nous prenons soin avec nous les corps. Surtout nous les yeux, un parti plus important. Quand nous les corps, nous prenons soin avec nous les corps, nous faisons un petit peu de prévention. Bien sûr, one question. Doctor,
yeah.
Does Dr. Manasa do the surgery or someone else does?
Okay. Okay. Cataract surgery is done by a visiting consultant. We'll be having a visiting consultant coming very soon. And diabetic retinopathies I treat. I give intravitreals, I do lasers. Even for cataract complication, we do lasers. We have the green laser, the YAG laser. Both the lasers we have, the green laser for diabetic retinopathy to prevent bleeding, which I do. The YAG lasers for post-cataract complications that I said, there's a fog, a layer of fog that develops behind the lens, that lasers we do. Injections I do personally, and the lasers I do personally, but the cataract is done by a visiting consultant that comes every 3 months to our center.
Voilà la réponse pour question. Il y en a visiting specialist qui viennent avec le docteur Murthy, il y en a pas mal. But visiting specialist, le docteur il est spécialisé bien sûr de diabetic retinopathie. bien sûr qui li fait mais ça pas empêcher pour descendre que docteur Murthy pour guetter quoi qu'ils ont fait à part ça toi quelque chose qui nous cause là côté centre là-bas que docteur Murthy il y en a pas mal quelque chose qui ont fait et pour qui fait besoin nous peut demander si capable payer par installment oui ou capable payer par installment dans ça 23 000 ou capable ces autres gagner dialogue ou négocier aussi ou capable gagner réduction si vous pouvez faire tous les des côtés lisier Dr. Manasa. Before we conclude, I give you the last word.
Oh, yeah. So, I'm very happy to be here. First of all,
It is a pleasure.
Yeah, mainly to create awareness. You know, there are a lot of misconceptions. It's like cataract is no, it doesn't happen to everybody, or it happens to certain only when they have certain conditions. No, it happens to me. It will happen to you. Depending on the age and
Everybody
other conditions. Everybody will get it. Suppose we live after 60, 65 years, you know. So, everybody develops cataract. Now, talking about diabetes and hypertension, it's not an eye condition, it's a systemic condition which are not in control. When the body doesn't have good control of diabetes, hypertension, when the patient has not controlled their blood sugar levels or the blood pressure levels, it shows in the eye. So, eye acts as a window. Eye acts as a window for multiple conditions. The ophthalmologist can see through and detect. There have been patients who have come to me and told, I do not have diabetes, I do not have hypertension, but I have diagnosed after looking at their retina. After an eye examination, I have diagnosed and told, no, you have to get your blood sugar levels checked, or you have to get your blood pressures checked. So, the eye acts as a window to multiple diseases, multiple conditions. So, visit your ophthalmologist very regularly, follow the instructions, and like I said, control of blood sugar levels, exercise, medications. You should know what to eat, what not to eat, and stay happy.
Just be happy. When you are happy, you live a longer life, a happy life. Par docteur, il expliquait, mais sûrement ça va être plus important, c'est visit your doctor regularly. Par il dit, et what not to eat and what to eat, ça est très important. Ou la diète, bien sûr, aujourd'hui, c'est ça, nous pouvons causer un petit peu, nous pouvons tous un petit peu lisier, cataracte dans les yeux, et aussi nous pouvons cause diabétique and hypertension, rétinopathie, nous pouvons cause avec Dr. Manasa, qui lui, côté Dr. Murthy, il déjà travaillé ici avec le ministère de la Santé avant, et là, il trouvait côté Dr. Murthy capable de visiter, call pour un rendez-vous, pour mettre l'appointement, voir qu'il y en a là, quoi qu'ils ont fait, et là, on est capable de faire ça dialogue, et après, on est capable de faire ça, si vous satisfait, si dans l'intérêt, si dans le bénéfice, ou capable ou satisfait là on va faire pour ou propre l'école. Dr. Manasa, merci beaucoup.
Thank you so much. It was lovely talking to you.
Absolute pleasure. Thank you for joining me today on such a short notice. Thank you so much, and I hope to see you again.
Pleasure, definitely. It's
definitely,
a pleasure.
because there is a lot that we have not touched, like glaucoma and everything else.
Yes,
Il y a encore des lisiers qui nous besoin de tousser, mais on espère pour besoin de docteur encore plus tard, après de l'année, pour nous tous, mais les autres quelque chose qui nous va encore tousser, côté lisier, y concerne. Docteur, so many thanks. I wish you a very good day today.
Yeah, you too. Have a good day.
You're going to the clinic now?
Yes, I'm straight going to the clinic.
I will not keep you longer. Doctor, thank you so much.
Pleasure.
Et c'est ça, c'est le topic conversation.